Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, December the 2nd, 2020. Joining us today is Mayor John Tory and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, good afternoon and thank you, Brad. Dr. Davila is not with us today due to a death in her family. On behalf of us all at City Hall and on behalf of the people of Toronto, who we all serve together, I have offered our sincere condolences to her and to her family at this time. She is as dedicated a public servant as you will ever find, but she's also a human being with a family, as we all are, and I know that she is very focused on that right now as well. She should be. Today, Toronto Public Health is reporting 438 new cases of COVID-19. There are 235 people in Toronto who are in hospital with COVID-19 and 51 in the ICU. Our work to confront this virus and stop the spread is continuing. The best way people can keep themselves safe and healthy and help us in this fight is to please stay home as much as they possibly can. This is not at all inconsistent with something else that we need right now, namely a strong show of support for your local restaurants through takeout and delivery. Today is Takeout Wednesday, as has been the case throughout much of the pandemic, where Wednesdays were a day that was dedicated to show our support for the restaurants through the takeout or delivery of food. And it is encouraged, of course, to get people to support their local restaurants. I know not everyone has the resources to do this. For those who do, I strongly encourage everyone who's able to do so to order a late lunch right now or order dinner for tonight. Each and every order you place with a local restaurant will help. It is one more way that you can help some people who need it right now, the hardworking women and men in our restaurant industry. And of course, there are thousands and thousands of them in one capacity or another right across this city. Every burger and fries or sushi or pound of wings or pizza or salad can help to make a difference to those people, to the business owners and to the people who work in those businesses. Thousands upon thousands of jobs and businesses could depend on the help that we voluntarily give by placing just one weekly order or more if we can. The government programs are helpful to a point, but we need to give these people business right now in order to help them to stay afloat. Let's face it. We're not asking you to punish yourselves by getting someone else to do the cooking and by asking you to treat yourself to something that you really do like to eat. So you can skip the cooking, probably means you can skip a large part of the cleanup. You get to eat exactly what you want at a modest additional cost because you're going to eat anyway. And you help to save jobs and businesses in our city, which right now is a major focus. Obviously, our major focus is on keeping people healthy and safe, but it's a major focus to help save businesses so that we can all learn to fight and live another day after this pandemic is over. All of this sounds like a quadruple win to me. I'm also happy to announce that the City of Toronto is reopening its green bond, originally issued for the first time in 2019, for an additional offering of $130 million to help finance capital projects that will help us in turn in our fight against climate change. This is the city's 5th public debenture issuance this year and the lowest 20-year term rate that the city has ever issued, with an all-in cost of 2.184%. And you know from some of the times when you're borrowing, that's a pretty good borrowing rate for the city to have. The city was one of the first municipalities in all of Canada to establish a green bond program in 2018. You might wonder, what is a green bond? Well, a green bond is a very important tool to help the city to deliver important green infrastructure. The funds from these bonds can ensure that we can continue to make important investments that will help protect the environment and improve the city for future generations. Indeed, the money from these green bonds has to be used for that kind of project. The proceeds from this particular issuance will be used to finance approved capital projects that deliver environmental benefits. And so, for example, it is going to finance Toronto community housing buildings being energy retrofitted, which will not just protect the environment against greenhouse gas emissions, but also save us money from heating costs going forward. It will also help us to finance the Portland's flood protection project, which is a climate change mitigation project, and TTC subway improvements. And of course, transit, by getting people out of their cars and onto public transit, is going to help us as well with our environmental objectives. The success of this bond is a further sign that despite the ongoing pandemic, investors continue to have confidence in this city and in this city government. It is sometimes difficult to find good news these days, as we know, but our credit rating, the agencies are people who look at our credit rating as they would look at yours in the banks, and they painstakingly pore over our city's finances and decide what our credit rating will be, whether it will change, up or down, or stay the same, and that has a huge impact on our cost of borrowing to build things like subways or to retrofit buildings. The credit rating agencies recently reaffirmed our city's strong AA credit rating. And they said as follows in so doing: the city's extremely deep and diversified economy will provide a foundation for recovery as the pandemic and associated restrictions ease. In addition, we believe that Toronto's prudent financial management and robust liquidity will help to sustain the city's creditworthiness in the longer term. I will just say to you that one of the reasons I wanted to share this good news with you today is because we can be justifiably proud as a city of this judgment rendered during a global pandemic. And I can assure you that despite monumental challenges, that prudent financial management that was discussed by the credit agencies will continue. Finally, I want to talk about something else that I think should give us reason for hope and maybe put a smile on some faces at a time when we need to put smiles on faces. Earlier today, I had the privilege of visiting Fire Station 315 in Midtown to welcome Captain James Warren back to work. Today was Captain Warren's first day on the job, back on the job, after he was critically injured last year fighting a 3-alarm fire on Shooter Street on November the 2nd, 2019. So he was off work for more than a whole year. He fell on that day 3 stories from the roof of a burning building on that terrible night. I stood on that street on that day visiting that fire scene and heard his fellow firefighters express grave concern about his survival. The doctors and nurses at St. Michael's Hospital saved his life and helped him to recover, with great encouragement, of course, from his family and great grit and determination on his own part. He left hospital about a year ago, and now he's back on the job, continuing to serve our city, as he has done for 36 years. Captain Warren is a hero, one of many frontline heroes in our city, and his determination to get better and to get back to work and to come back physically the way he did is an inspiration and should be an inspiration to all of us. I know there are many others who have fought off illness to get back to work, many other frontline workers in healthcare and in many other areas, transit, and all of the areas that have kept city services going, and people beyond the public service who have kept our grocery stores open and kept serving us in many different ways, and many who've shown the courage to keep doing their vital work when doing so has put them at increased risk to their own health. So to all of them, I say thank you for your dedication and for your courage. I say thank you for keeping the rest of us safe and healthy. We need that hope and we need that inspiration. We need that service, that continued service from you right now, right from Captain Warren, from firefighter Terry Limonis, who also was injured on that day, though less seriously than Captain Warren, and all the other people who are facing this kind of risk and this kind of circumstance in these unprecedented times. I will now ask Chief Pegg if he will give his report for today.
Thank you, Mayor Tory. Good afternoon. Before I begin, if you'll permit me, I'd just like to join the Mayor in extending sincere condolences to Dr. Davila and to her family as they navigate this difficult time, and also in both acknowledging and congratulating Captain Warren for his return to full duties today. That was something that certainly brought a smile to my face and candidly to the faces of the women and men that serve alongside him every day. So congratulations, Captain Warren. 267 days ago, we activated our Emergency Operations Centre in response to COVID-19. As a city, we continue to provide the essential and critical services that our residents both need and rely on each and every day in Toronto. For example, emergency services, including paramedic, fire, and police services, continue to be delivered without interruption. Toronto Water continues to ensure our drinking water is reliable, safe, and remains at the high standard we have all come to expect. Road operations, including snow removal services as required, continue as normal. Toronto Hydro is operating normally, and 311 is operating normally with service levels at or above the established performance targets year to date. In response to the COVID-19 pandemic, the delivery of city services has evolved quickly in response to the increased need for remote work and technology-based service delivery. This would not have been possible without the expertise and dedication of our technology services and people and equity teams, who have enabled these solutions in live time. In keeping with the best advice and direction from public health, a considerable number of our city staff continue to work remotely. In fact, earlier this week, City Manager Chris Murray advised city staff that the current remote work policy has been extended to March 31st, 2021. These policies are continually being reviewed and updated as required by our senior leadership team. Our essential and critical services staff, who are unable to work remotely given the nature of their roles, continue to report to work while being supported by enhanced infection prevention and control practices and through the provision of personal protective equipment as required. Our PPE supply chain and inventory continue to be managed effectively. As of this morning, 49 of the city's outdoor artificial ice rinks are open for leisure skate, with a maximum of 25 people per ice pad. Since the outdoor rinks opened on Saturday, more than 32,000 reservations have been managed via the online reservation system. Additional walk-on spaces are available for those who cannot reserve online. After-school recreation care programs are operating in order to provide essential child care services to families. Although most programs and services in community centres are closed in accordance with the provincial lockdown regulations, more than 50 community recreation facilities remain open to provide washroom access for residents. Additionally, the city has more than doubled its supply of winter washrooms in city parks, including 45 winterized washroom locations and 51 locations with portable toilets. Public washrooms are also available at the city's outdoor rink locations. I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. Before we go to questions, just a reminder to please unmute yourself. We also have a number of staff on the line should you have specific questions for them. We go first to Haley Cooper from News Talk 1010. Haley, go ahead, please.
Thanks so much. My first question is for Mayor Tory. Given that we've learned 20% of people who have COVID have been indoors with people at their home or someone else's home, is anything more being thought of to stop these gatherings?
Well, we have provincial regulations in place now that say people should not be having these social gatherings in their homes and that they should basically limit themselves to the people they live with. And I can just tell you there have been no discussions, certainly not as between the province and ourselves, about trying to strengthen that or to change that because, you know, in the end, I think given some of the issues we would have, for example, if there ever was such an order with enforcement, you have to ask yourself whether we really, you know, we're really going in the right direction if we do that. The right direction we should be going in is as a people, as individual citizens, that we should be just deciding that we're not going to socialize in that manner. We're not going to have people over. We're not going to go over to visit anybody else if they're not the same people we live with. And I think that is going to be a more effective way of dealing with this. And there are clearly some people that don't seem to get that message. We have, as you have seen, some enforcement efforts that have been undertaken on the weekends that have resulted in some of the bigger parties where we get a call to 311, and we've had people go out and enforce the law where necessary there. But I think in the end, this is really something that's best done by people changing their individual behavior, and I think the vast majority of people actually are behaving. One thing you can't stop is people who do go out to work, because we say that if you have to go out to work, if you have to go to school, people do have to go shopping once a week, that they might bring the virus back into the house. But if people follow proper precautions even on those shopping outings, don't make it a family outing, go once a week, stand in line physically distanced, shop physically distanced, the chances of bringing it back into the home and being a relative who gives it to somebody else are, I think, dramatically reduced.
Thank you. And my follow-up question, it's been uncovered that the owner of Adamson Barbecue has never had a business license for his Leaside location. And we wondered, with all the rigorous inspections that restaurants go through even before COVID, how is this possible? How did he get away with this for years?
Well, first of all, maybe it goes to personality type, but I think the best way to have that question answered is to ask Mr. Grant to answer it in terms of the efforts that they make and what they've been asked to do for us over the course of the summer, which is a very deep and lengthy list of things they've been asked to do on our behalf over the summer.
Thank you, Mayor. Unfortunately, Carlton Grant just dropped off the line, so we'll come back to Haley. I can attempt to answer that. I am familiar with this issue. He has been summoned, received 3 summonses from the City of Toronto for operating without a business license. It is the courts, though, that impose penalties against businesses that operate without a license. There are some zoning issues within that area as well that are not in compliance. So that is the current situation. The municipal licensing and standards officers do frequently attend businesses to determine if they're operating without a license. This year, those numbers are down because they have been redirected, as you can appreciate, to COVID-19. But once we get Carlton back on the line, I see he is back. Carlton, do you have anything you wish to add? You're going to have to unmute yourself, though, please, Carlton. Thanks for your patience, Haley.
Did he hear the question too, Brad?
Did you hear that? You were able to hear the question, Carlton?
No, I did not. I just got back in. So
Okay, I can repeat it.
Thank you, Haley.
It's been uncovered that the owner of Adamson Barbecue has never had a business license for his Leaside location. And we just wondered, with all the rigorous inspections that restaurants go through even before COVID, how is this possible and how did he get away with this for years?
so I'll start by, one, it's disappointing that he's flouting the law like this. We have issued charges in the past. We are continuing to work with them to bring him into compliance. There is a zoning issue in the Leaside location where it's not permitted, and he'd be required to get a change of use permit with Toronto Building. So there is a vehicle to get licensed. We need to work with the proponent, but the proponent doesn't seem to want to work with the government. So it's something that we're going to have to press on.
Carlton, thanks so much. Haley, thank you. We'll go next to John Chidley-Hill from the Canadian Press. John?
Good afternoon, everyone. My question's for Mayor Tory. This current second wave we're in was partly fueled by people seeing each other over the Thanksgiving holiday. I'm wondering if people see each other over the winter holidays and that leads to another surge of cases in January, what options are left for the city to try to slow and contain the spread of COVID-19 in the event of I guess we could call it a third wave?
Well, I can only hope that people will take the advice, and we plan to have further comment on the provincial paper, a very complete 13-page paper that exists that offers advice to people on how to handle the Christmas and winter holidays upcoming in this month of December. And I can only say that we have relied throughout in all of the restrictions that we have either advocated or placed on people and businesses ourselves as a city on the advice of medical and scientific experts. And so we will, listen to them. We would hope, first of all, that people will comply over Christmas and we won't have that kind of a problem in January or February or March. But if problems arise, we will do exactly what we've done all the way through, which is to sit down and listen to them with respect to the best kinds of measures, talk to the province about that, talk to their experts, and do whatever we think is necessary to protect public health, to protect the healthcare system, and to protect our way of life, which includes consideration, obviously, for business.
Mm-hmm. On the note of business, I was curious, obviously, despite everyone's best efforts, this pandemic has been hard on businesses, and a lot of businesses have had to give up their space, and a lot of corporate businesses are contemplating a shift to work from home or partial work from home, even when the pandemic is over. I'm curious, are you concerned about the commercial real estate market in Toronto with all those businesses closing and some corporations moving to more of a work from home model?
I'm concerned about the overall impact the pandemic has had on the economy, including ultimately on commercial real estate, on small business in particular. But I'm also buoyed by the fact that when the pandemic is over, this will still be what it was before the pandemic, which is one of the most attractive places to live and to invest in the whole world. I think, if anything, Toronto's become more attractive during the last 12 months than it was before, for a bunch of reasons related to the careful way in which everybody has conducted themselves. But we need the pandemic to be over, and then I think we can get back to doing what we have to do, which is attracting investment and people from around the world to come here and build our economy back up. And that will include new businesses that fill up the office space that may be left empty, and includes new leases that will be entered into by new businesses in those storefronts. So that's my job, is to make sure that we're on top of that, and we're already talking about that and the plans we have to execute when the pandemic is over. But first order of business, get this pandemic behind us.
Okay, thank you. We'll go next to Matt Bingley from Global News. Matt, go ahead.
Good afternoon. Mayor, it's clear that some people still are not really getting the message, and that some of that just simply checked out of the city's messaging. We've seen you try different things with the Use Safe 6 and your TikToks, but some experts are telling us that maybe it's time for the city to consider tapping into people's emotions to start showing the direct result of what their actions bring. We've seen some ads from Scotland doing that. Do you think it's time that the city should start considering stronger messaging?
Well, I will say we're seeking out the expertise of some of the people that are in the business. I don't want to have this come down to sound like it's kind of marketing as you would sell, soap, but you have to sort of message in the most effective way that you can. And I've seen some of these other ads from around the world. I think some of what we've been doing is effective, but so I think we're always looking for different ways in which we can get our message across, but remembering that we've been talking about people not drinking and driving for probably 50 years intensively, and there's still people who insist for some strange reason in doing it. We've been talking about distracted driving and saying how wrong it is. We've told people they shouldn't smoke because it kills them. And so, it's frustrating to have what I think is a relatively small group of people out there who just insist on it's not that they don't hear the message, it's that they choose not to follow it. We're just going to have to keep at it, and we will keep at it. And thankfully, the majority of people are following the advice and doing whatever they can do. And I think we will see progress made as a result of that.
Can I just ask you how shocked you were by that statistic that was put out yesterday of the 1 in 5 people still going into people's homes or having people in their own homes?
I was astounded by it, because the message has been so clear in saying not just stay home, but only hang out with the people that you live with. And so to see, that much in the way of people deciding that they're going to either ignore or find an excuse to put that message aside is surprising, especially when you think about the fact that that's potentially damaging to their own health, damaging to the health of their relatives, damaging to the health of their coworkers, their fellow students. It just doesn't really make any sense. But again, it's one of the reasons why we have to keep at the message, and why we have to find new and different ways to get that message across so that it might penetrate to, an even greater majority than it has. Most people are following it, but some people are not.
Thank you. We'll go next to Kevin Connor from the Toronto Sun. Kevin, go ahead.
Hi, Mr. Mayor. The city of Mississauga just announced again that there's another round of layoffs, and I'm wondering if that's a road Toronto's going to have to go down as well.
Well, I think depending on how they use the word layoff, we've had a number of instances affecting a total of about 6,000 people during the course of the pandemic who have been placed on significantly altered employment circumstances. In some cases, what you would call a layoff. In other cases, they've been redeployed to go and work somewhere else other than in their jobs. And so we are taking the steps that are necessary, for example, in hiring fewer or calling in fewer of the people who would work part-time for us in some of the programs that just aren't happening. So I think you would expect us to be doing the things we're doing as a matter of prudent management, and different people describe those in different ways, but we have people today who are not doing work for the city who would ordinarily be doing work for the city because of the fact the programs aren't being offered, and we have others who've been redeployed to help us with some of the challenges we face because of the pandemic who are not doing their regular jobs. So there are no people that are sitting around doing nothing, and nobody who wants to be doing that. And I can just assure you we're using all hands on deck, but in some cases it has meant people have been not doing their jobs and having to rely on public benefits that are available to everybody else in order to look after their families in the meantime.
Okay, thank you kindly.
Okay, Kevin, thank you. We'll go next to Dave Ryder from the Toronto Star. Dave, go ahead.
Hi there. I was hoping to circle back, first of all, to the Adamson barbecue situation and ask Mayor Tory to address that. It seems like you sort of dropped the hammer on a guy and had some trouble doing it, but finally closed it. But then a lot of people will look at this and say, but it was operating for, he's had two places without business licenses and one at least that is going against zoning. What do you make of all that?
Well, again, I'll turn to Carlton Grant to deal with it, because you're talking here about the enforcement of the law and about different things this individual and his business had done, because there were convictions registered against him. And I will only say, again, it's back to what I was saying earlier on about different measures that are taken to stop people from distracted driving or from drinking and driving, or things that we clearly say are against the law, and yet there are people who are repeat offenders. There's only so much you can do with regard to those people, and it's profoundly frustrating and disappointing because they make it a bad scene for everybody else. And they disregard the public interest, which I think most people actually in their day-to-day lives do take into account. Most people think about other people. They think about their fellow citizens. They think about public health. They think about, what's good for the city as a whole. There are some who don't. So on that note, maybe I'll ask Carlton if he can talk about this pattern of behavior that you made reference to.
Go ahead, Carlton. Thank you.
Yeah, thanks for the question, David. Again, it's a very small number. The mayor is correct that most people follow the rules. Most people want to follow the rules. And in this case, we have an individual who doesn't want to follow the rules, that is potentially anti-government and doesn't want to follow the rules. It's also my understanding that the Queen Elizabeth location in Etobicoke opened early this year, just before the pandemic. We will be looking into this. We have been issuing charges to both locations for not having a business license, and we will do what we need to do to either shut them down or bring them into compliance with the appropriate licensing, the appropriate zoning, and the appropriate building and fire inspections.
Thank you. And the follow-up question was going to be for Dr. Davila. I think I heard that there's a public health person on the line, so I'll ask it. If nobody can answer it today, I'll ask it for another day. And that was if there's any update for Toronto on the vaccine timeline, because Dr. Davila had indicated she thought that the first doses might go into the first priority people, I think, in the first quarter of 2021, but that we might see more of a general rollout. I think she said sort of like late spring was the timeline. So maybe somebody from public health or maybe Chief Pegg can tell me if there's an update, because there have been some federal talk later, more recently, that suggested maybe generally it would come later.
Thanks, David. I'll do my best. The short answer to your question is at this point we don't know. We are, of course, in direct cooperation and collaboration with the province of Ontario through their immunization task force, and as you know, have commissioned our own immunization task force some weeks ago. Our responsibility in the city is, of course, to ensure that everything is in place and to make sure that we are ready to support Toronto Public Health in the rollout of the mass immunization program here in the city at such point as the province indicates they are ready to go, and at such point as they provide and make available the vaccines. But having said all of that, at this point in time, we have yet to receive concrete information or concrete dates from the province, and I would say that information is forthcoming.
Okay, thank you. Final question is to Julianne Lamoureux from Radio Canada. Go ahead, Julianne.
Bonjour tout le monde, bon après-midi. I'd like to have more details on the source of infection in Toronto with the recent hikes of cases. So we have some sort of answer with the statistics saying that 1 in 5 who had the virus was visiting someone in their household or had visitors at home. Do we have more recent data about where people in Toronto are catching the virus?
So I'll ask Gail Bursey, from who is a policy director within Toronto Public Health, to answer your question, Julianne. Gail?
Sure, thank you. Can you hear me?
Yes, we can. Yes.
Okay, so it's an interesting question, and you've heard Eileen speak a few times about how hard we work to try and understand the source, and how cases that we speak to are also working hard to understand exactly where they've been and who they've been with. The survey that you're mentioning is one that we did very recently, where we asked individuals if there was a positive case that they were associated with for any length of time, who was it? And as you mentioned, it was people within household. It was a spouse, it was a relative that they lived with, or in some cases it was staff. So that's the information we have to go on from that survey. We're going to continue to do that survey, and as we collect a considerable amount of data and can make more conclusions, we'll be back to you with that information. But in general, the stage that we're at in the pandemic now, we can assume that the individuals that you interact with outside of your household are a risk, but also because people are coming in and out of households, those individuals within your household are also a risk. So again, that's why that same set of messages is so important about hand washing and mask wearing and keeping distance when outside of the essential group of people you have within your household. So thank you for the question, and more to come.
Right now, the asymptomatic people who qualify can get tested in pharmacies. Would you like to see more asymptomatic be able to have access to the test, given that we know with the pilot project in schools that they are able to pick up asymptomatic people with the virus? So is it something we should be doing?
Again, a good question. It's good to think about that. You've heard, again, Eileen, talk about how we're open and learning about this virus throughout the pandemic. At this point, the advice that's on the Ministry of Health website that tells you which symptoms you need to look for if you're going to seek testing is the best place to go to understand whether you need to be tested. So at this point, no, we're not anticipating a change related to asymptomatic, but we're certainly open to learning and continuing to understand the virus as we work through the various stages of the pandemic.
Okay, thank you very much, Gail. Thank you all for joining us. That concludes today's briefing. Please stay well.